So, hello, dear friends. Welcome to the channel once again. This is a different type of a video session in which I'm going to reply to the questions that you have asked on the channel previously. And why? Because the content of this channel is dedicated to you who have subscribed to the channel. So, this I'll follow on a weekly basis. I'll try that whatever questions you put in the previous week, I'll try to answer some of those so as to guide you. Now, coming to the first question. Okay, just a second. So, the first question is it's not a question, it's a comment. So, proud of you, sir, being a Kashmiri student. Thanks for your nice comment. I'm a NEET UG aspirant and I've recently given my 12th board exams and I'm dreaming of getting into AIMS since I was in 10th grade and inshallah I will achieve my goal. Shanze is the name of the subscriber. So I wish you good luck for AIMS exam for the next exam that you'll have to appear, the NEET UG. I wish you luck, and for those of you who don't know me, yes, I'm from Kashmir. I've done my I've done my MBBS from GMC Srinagar, and then I did my MD, and now I'm doing my DM from AIMS New Delhi. Sam has asked, if we just look at the clinical exposure part of India versus US, does India have more variety of cases and owing to its massive population? Well, if you consider big hospitals of India, yes, we do see a lot of cases. And interestingly, we see the cases at all the extremes of the spectrum. We see even cases at a very advanced stage that people in US would not see. But then training in US college is a different experience. There, the job, there, the specialties are they're established. So every specialist takes care of that particular problem, that particular clinical patient. Here, it's sort of a jumbled one department taking care of all the problems, and it's different. It's different. But if you do residency in medicine or pediatrics from a central institute in India like AIMS or PGI or JIPMEN, you will see almost all kinds of cases that are described in the literature. Kushagra Singh has asked how much college matters in MBBS. Well, I'll tell you, in short run, it matters. In long run, I don't think it really makes that much of meaning. But in short run, yes. So if you do your MBBS from a big college, a big state medical college or a central university like AIMS or maybe JIPMER, you get a lot of exposure, a clinical exposure here. Wards are filled with awesome clinical cases here. Faculty is awesome. So you get that extra advantage. In addition, you're subjected to research work very early in your MBBS career. So I see names MBBS students taking part in various research projects. So that is different. But in the long run, if you read well, even in a peripheral medical college, you can then join some of these central institutes at your MD level or maybe at your senior residency level or for DM or MCH exams. So in the long run, it would not matter much. Roshan Afroz has asked, after doing MD in India, can we do USMLE, and will it be more beneficial to give USMLE after MD rather than MBBS? See, you can give USMLE at any point of time. I can give it after my DM, but it's better that you do it after MBBS, because if you spend your 3 years doing MD or doing MS at India, then you'll have to repeat that residency in US. So, and you will not be able to bypass those USMLE steps. So it's better that you start preparing in MBBS, then give these USMLE steps immediately after MBBS, preferably in your internship, and then join a residency program in US if you wish to go to US instead of staying in India. Jalak has asked how to clear all the basics with deep understanding for USMLE and NEET PG. Answer this as if you're telling this to a class 12 student. Well, this is not a valid question. If you're a class 12 student, you should focus on the NEET UG. You should be concerned about physics, biology. You should be concerned about NCRT. This is of no business to you. Don't think of PG and USMLE at this stage if you are a class 12 student. Abikarsa has asked, if you get time, could you upload a detailed video regarding the books we should use? I've uploaded a video on the books we should use during first year MBBS. But let me repeat that. Read Guyton and Hall for physiology. That's more than enough. Read B.D. Chaurasia for anatomy. That's more than enough. Read, I like the book by Vasudevan in biochemistry. You can read Harper if you wish. But it doesn't really matter which book you read. If you read and understand the concepts and then practice them with your friends in the dissection hall and the physiology practical labs or in your classrooms. See, first year MBBS is more of a school learning. It's more of theoretical learning, but you'll find difficulties in anatomy. For that, get a good atlas. Every atlas is equally good. Get a good atlas. I used Macmillan. You can use Netters, or even Gray's has an atlas of its own. Watch those atlases and then come the next day and do the practical in the dissection halls. You can watch videos on the YouTube like Ackland's anatomy videos. They're awesome. For other branches like neuroanatomy, histology, or maybe osteology, it doesn't really matter which book you read as long as you understand the thing. And for neuroanatomy in particular, I think it's impossible to understand at that particular level in your medical career. I read neuroanatomy in my third year MBBS from Snell's and from USMLE material. So read what everybody is reading: Guyton and Hall, BD Charasia, and some book in pathology. Then, can you please give some guidance with respect to NEET UG? Pakiza Majid is asking. The point is that it's been 10 years since I've appeared in JKCT at that point of time. It's been more than 10 years I've read biology, physics, and chemistry. If you make me write that exam again, I won't get selected for MBBS entrance, of course. But what I can tell you is that NCRT was the standard then. NCRT is the standard. Now, everyone has qualified NEET UG with flying colors after reading the NCRT text, especially for biology, especially for chemistry. Physics, you can consult other sources for doing, practicing the questions. And don't forget to practice MCQs. Whatever the subject, bio or physics or chemistry, you have to practice MCQs. Please make a video on career options after MD Pediatrics. I've done MD Pediatrics, and MD Pediatrics I like for a reason that you are open to do a super specialization in pediatric super specialties or adult super specialties. You can join these programs like neonatology, pediatric neurology, pediatric nephrology. Everything is possible. It depends on what you like. If after doing MD Pediatrics, you feel you want to learn a specialty as a whole, then probably the adult programs, for example, nephrology or adult cardiology, they make you learn cardiology as a whole or nephrology as a whole. Then if you wish to see pediatric patients, you can focus on that particular age group. It's a very personal decision. Coco is asking, I wish I had some mental IQ during my preparation. Well, of course, this is why the channel is there. If you have any doubts, post them in the comments. I'll try to answer most of the things that you ask. Sir, which books to follow for third year? Well, third year is comprised of ENT, ophthalmology, and PSM. Well, to be honest, except PSM, the community medicine, I don't feel, the ophthalmology and ENT, they're small subjects. You can read all of that in maybe 1 month for ENT, 1 month for ophthalmology. That's all. Whatever book people read Dingra, I had read Dingra for ENT, and I don't even remember the book which I had read for ophthalmology. It doesn't matter, whatever. Read it fast because it doesn't, it's a specialty in itself. Ophthalmology is a big branch, but not for an MBBS student. So you can read it for a month, whatever source you want, but focus on the community medicine. That is very important during MBBS and after MBBS. It helps even now. I'm doing DM, but the concepts of epidemiology, concepts of biostatistics, the understanding of community medicine, preventive medicine, that is very important that you cannot miss. And I suggest in your third year, practice and do clinical subjects like medicine or surgery. Go to the wards, learn medicine, learn surgery, bedside, and read from the standard medicine and surgery books in your third year if you are studious and if you want to read. CB Sai has posted that, sir, I've currently just entered into final year and I'm from a peripheral private college. I have anxiety as to whether I can complete all 19 subjects in the final year. See, you're not the only one who has the anxiety of doing 19 subjects. No matter who you are, no matter what your IQ is, no matter which college you read, everyone will, have this anxiety regarding full big bundle of 19 subjects, maybe 19 times 2, the number of books. This is a huge amount of information, but you have to stay focused. You have to do as good as your other people who are competing with you. You don't have to master all the 19 subjects. You have to do as good or maybe better than your competitors. Single stroke. What problem students face after completing MBBS from foreign countries? Well, I've seen many of the foreign national who have done MBBS from outside, from different countries. Well, felt that some of those colleagues have a very poor clinical exposure. I've seen people who have never seen a case of a stroke, who have never evaluated a patient of Parkinson's disease in these colleges. So that part, see, textbooks, theory you can learn from videos, you can learn from textbooks, you can memorize anything in the book, but you will not be able to learn the practical skills that you will learn in a good college that has a good amount of patient load and good faculty to teach you clinical medicine. Medicine is not just science, medicine is an art that you will have to learn clinically. And if that particular foreign college is small, is not giving you enough clinical exposure, that is of course a downside for the rest of your life. Shehriyar Afzal is asking, can you post daily one video of a clinical case that you see in your OPD? I am a DM student and I have a very busy schedule. You, as an MBBS student, may be free by 4 o'clock, but I work for sometimes 30 hours at a stretch. Okay, so it might not be possible, but I'll try to make a series of videos on clinical vignettes, which will help you in your preparation for next exam. Tara Maheshwari, you deserve a lot of subscribers, doc. So that's up to you. You guys can subscribe and like and share the contents of this channel. So see you in the next week. I'll try to answer the queries that you will have in this next 1 week. Thank you.